and nurse practitioner Matt Draper. Good morning.
Morning,
Gentlemen, how are you?
Good. Thank you for having us.
Thanks for taking a break from surgery to come see us. So, how's everything going?
Everything's going very well. The practice is going well. We're thriving. We're
Awesome.
continuing to be busy and taking care of patients. So we're excited to celebrate our 1-year anniversary.
Congratulations! Yeah, it's awesome.
Flew by. I remember being at your grand opening
Yes.
and ribbon cutting, and you were there at the beginning. I think you guys have built a team that has stayed with you, and it's a lot of local people that the community knows and trusts from all of their years in business. And you've been, I think, for me, I've known you for a long time. Matt was my trainer.
Yeah, started
And
back in 2010.
Was it because of me that you got out of the training?
Not because of you, but you were the last client that we had that before I transitioned into the nursing role. So change is change, right?
Well, I remember you were going to school
Yep.
for nursing, so I know that was your long time dream. What was it about Dr. Ekpo that attracted you to his practice?
Yeah, so starting off in athletic training, at orthopedic rehab in 2010, and then working through to nursing school, and then working as an ER nurse there at Henry Ford for about 5.5 years, going to nurse practitioner school, and then started off in clinical working in orthopedics at Henry Ford as well, and then got the chance to meet Dr. Ekpo and kind of get to know him. And I'd always kind of wanted to do orthopedics just with that athletic training background, and then sitting down and meeting him for an interview and getting us started, and then everything kind of grew from there. And then now, going on almost 3.5 years together since 21 has been great for me, educationally, learning, changing roles, and kind of expanding.
Dr. Ekpo, I've talked to a few of your patients, and they rave about how you put the patient first, number one. Talk about that type of care and why it is so important to put that patient's needs number one.
Yeah, absolutely. I think that, over the past decade, going on 12 years now of taking care of patients here in Jackson, you learn a lot. You figure out, what matters most to patients. And part of the transition from leaving our prior facility and kind of establishing Michigan Joint Replacement Institute was to provide that empathetic, compassionate care for patients, and really being able to do it in a way that we felt we could do best. And I think a lot of that resonates with a lot of patients. We take our time with patients. They don't feel like it's a factory going in and going out. You get 30 minutes, any questions. I don't leave until every single question is addressed from our patients. And that's not just me, that's Matt, that's Nick, that's everyone in our office. We want patients to feel comfortable leaving, knowing that everything's been addressed. They're prepared and ready for surgery or non-surgical management. We just want them to feel really comfortable, just the way we'd want to feel if we were a patient.
I was going to say, I looked at Dr. Google this morning, and Dr. Google told me that 1 in 10 Americans will need a total knee by the time they're 80. And I'm wondering what type of factors, health, lifestyle, that can move that up to, say, 40 or 50, where you start to really have those issues.
All right, and it's multifactorial, right? Some of it is genetic. If you've got like an inflammatory rheumatoid arthritis, those things are genetic and they really just can't be helped. But for the most part, for the just wear and tear of the joints, a lot of that just has to do with the way we've lived our lives. And the way we live our lives, healthy, active lifestyle. So when I think about joint replacement and patients coming in saying, oh, I'm 40 years old and my knee's shot, and I say, well, what did you do over the past 20 years.
Yeah.
Well, I played soccer, I played rugby, I played basketball, I did all of these things that I wanted to do, and I absolutely loved it. Those are the things that I like to hear because yes, you've got a knee that's arthritic, but you've done everything that you wanted to do to get to that point. And so, I think things that you can do to improve your chances of not having a knee replacement down the road, healthy, active lifestyle, not doing activities that are really detrimental to like a pounding of the joints, things of that nature, and then of course keeping your body weight at an ideal.
So a lot of people are going to get pain. They're going to experience pain when they're running, working out on the bike. How do you know, if this is good pain or if it's pain that you need to go and talk to you guys?
Well, I think being mindful of your body and knowing what's different, right? So if you're normally active, normally healthy, running, exercising, you kind of know what to expect that next day, that 48 hours after. when you start getting a couple days further down the road and, this isn't normal, this is something that's, bothering me more than it should, it's a good idea to get x-rays, take a peek, make sure everything looks the way it's supposed to, and and treatment plans can kind of start from there. If everything's looking the way it's supposed to, you can manage it from a musculoskeletal standpoint versus actually like searching for an operation or searching for a surgical means, down the road.
I'm a patient of Dr. Ekpo's.
I didn't know
I wonder if the hip thing's hereditary. You might have to be a patient of Dr.
I don't know. I think that was just because you walk funny.
I walk funny because I'm mad.
No.
No, that's right.
Those
You
are
walk
back to
funny.
back.
You walk
Those
funny
are the
before
squats
you
and
met.
leg raises. That's not my fault. So
You
I
walk-
didn't set the program. I just ran it.
What you said about giving time to the patient is
Oh, it's
true.
key.
And I remember when you first came to Jackson, we had coffee, and you gave me all the time in the world. And again, last year in our appointments, it was as if I was the only one in the whole building. And I didn't feel like there were other people that were waiting to talk to you or other places that you needed to be. And I think I think it's pretty unusual to experience that in any kind of a medical practice. And I can tell you go out of your way to do that. It's purpose.
It is. It's the way that I would want to feel if I were a patient. I think in medicine today, it's very much the opposite. And so if we have the opportunity to change that and make that change in a meaningful way that really helps patients feel comfortable, that's what we're going to do.
I have to assume that you both see patients that should have probably come in maybe a couple years before they do see you. There's no shame in any of that. Just come right away, right?
Yeah, exactly. You shouldn't. There is no shame. I think a lot of us are stubborn and we wait until something really hurts or bothers us to actually show up to the doctor's office. So, yeah.
I invented a word when I was with Matt. It was called prehab, because I knew I was going to have to get in shape before I could get a joint replacement, hip replacement. And it seemed like it was a pretty critical step that a lot of people don't even think about.
Yeah, it's nice to go into any operation, whether it's the total hip or the total knee, with having some built-up strength, good range of motion as much as possible. If a joint is pretty limited, what it can offer you, at least you can strengthen what's around it and make the recovery a little bit easier.
And then on the other hand, rehab is equally as important. A lot of people just kind of peter out on that, probably more often than you would like.
Yeah, I talk about physical therapy and I say, I can do the best job possible for you. I can give you the perfect knee, but it takes two, right? We're a team. So I do my part, you do your part. You put in the effort, you put in the work, and you'll get the results at the end of your therapy. So it's certainly a team effort.
Are those pickleball injuries coming in?
All the time, every day. I love pickleball.
But let me ask you a little bit about that, because you have people returning to active lifestyle or returning to sport, and whether it's pickleball or something, your movements, your athletic movements are a lot different than they've been previously.
Right.
Does that impact a lot of your joints in a negative way when you're just all of a sudden getting into this new sport, new athletic moves when you haven't done anything in, say, 10 years?
I think it could change just the overall kinematics or the way that your body kind of functions normally. But I'll give you a quick story. We have a 91-year-old patient who traveled from about 6 hours away to have us do a Jiffy knee for him. And I said, what is it that, you're 90 years old, what is it that you would like to do? He said, I would like to continue playing pickleball at 90 years old. We did both of his knees within the same year, and he's back to playing pickleball. We hope to have a video of that pretty soon.
Cool.
But it's about quality of life, right? It's about returning to the things that you want to do, and that's what we're here to help you get to.
And you have something called the Jiffy knee, which Jiffy, obviously, it's
Quick.
fast. It's fast.
Yeah.
In a
By the way, I talked to Howdy Holmes about your use of the word Jiffy, and he's okay with it until you start making cornbread.
It is not the Jiffy Mix knee. That's for that's for sure. Yes, it's a minimally invasive technique where we don't cut through muscles or tendons, and it's just been a phenomenal thing for us. Patients travel from literally all over the United States to come to us to have that procedure performed, and they just do amazing.
It's amazing.
Yeah, amazing. Like it's outpatient. Everything's outpatient, right?
It is.
Yeah, goal is to get in, get the surgery done, get you home where it's more comfortable, relaxed, with family helping to take care of you afterward. And just reduce that stress of like being in a hospital environment. You can get home, get in your favorite pants, watch TV, all that kind of stuff, and then get active, right? So the way to decrease stiffness, get up, get moving, use it, and enjoy the new hip or knee. I mean, that's the whole reason that you're going through it.
I think what you said too, least amount of stress as possible. I mean, that's what we're dealing with all day, every day. So making it easier on people is key.
Yeah, you're walking the same day. It's amazing.
Yeah.
Well, congratulations on the success and on your 1-year anniversary.
Yeah.
Thank
Thanks.
you.
Thank you, guys.
Much
Thanks for having us.
appreciated. Thank you.
From Michigan Joint Replacement Institute, Dr. Tim Ekpo and nurse practitioner Matt Draper. More of the morning show after this.